will stop talking and hand it over to Carlos.
I'm going to hand it over to Aamna Nayyar from the Sisters Food Project to start us off. And so it's all yours, Aamna, and then you can pass it on to me.
Fantastic.
Thank you very much, Mr. Navarro. A'udhu billahi minash shaitani rajim. I seek refuge in Allah from the outcast shaitan. Bismillahir Rahmanir Rahim. In the name of Allah, the most gracious, the most merciful. Using the words of the prophets, I want to greet everyone. Assalamu alaikum, meaning peace be upon all of you. I welcome you to our World Food Day event of 2024. My name is Aamna Nayyar, and I'm a member of the steering committee of the Interfaith Hunger Coalition. And I also volunteer as the marketing and public relation coordinator of the Sisters Food Project, which is under the umbrella of Islamic Center of New Mexico. The Sisters started this food and hygiene project in April 2022 after, we were working on our own, but we formally started in April 2020, not only for the Muslim community, but for everyone in the Albuquerque and the community at large. First, we used to distribute bi-weekly, but then our resources were running short, so we went once in a month. But thanks to the New Mexico Roadrunner, we are still once in a month, but our quantity has increased. So we are serving on average 100 families per month. This program is completely supported by the volunteer sponsors and the community members. So I do appreciate giving me the chance to give a little shout out for our charity program that we're doing. And I will return the program back to Mr. Carlos Navarro, the convener of the Interfaith Hunger Coalition, who will tell you more about the panel. Thank you.
Thank you, Aamna. The Interfaith Hunger Coalition has observed World Food Day since 2016, and we are excited to commemorate World Food Day again in 2024. This year, we have invited providers from 5 different areas in the state of New Mexico to tell us about their efforts to meet the rapidly increasing need for food in their areas. The state of New Mexico, including the governor's office and the state legislature, with input from many of us from civil society, is making great strides in fighting hunger in New Mexico through the food initiative in the state legislature. The effort connects all the dots, looking at all the factors that are connected to addressing hunger, from enhancing school meals, connecting small farming operations with schools and other institutions, addressing infrastructure issues, and finding ways to provide direct assistance to some of the providers who will present in this panel. We have a long way to go in our effort to end hunger in New Mexico. Our ongoing efforts have a direct correlation to the theme of World Food Day 2024, which states that food is a right every day for everyone, everywhere. We tried to cover all the corners of our state, but we are aware that we could have included more voices from other communities in our conversation. Still, I'm sure we will hear compelling stories from those who are scheduled to present. Our presentations will be made in alphabetical order of each community. I will introduce each presenter before each presentation. I will start with Ari Herring from the Rio Grande Food Project in Albuquerque. Ari is she has been executive and co-executive director of the Rio Grande Food Project since 2016. Ari is focused on the Rio Grande Food Project's current hunger relief programming, as well as its strategic expansion to ensure improved food access and more long-term food security within the Albuquerque community. Take it away, Ari. You're mute. You're muted.
So sorry. Why am I not surprised I started off that way? Hi, everybody. So wonderful to be with you all. Thank you for everything that you all do. It's an honor to be able to be in the midst of your good work and determination. So I'm gonna start off by telling you about a man named Delphine, who is a really special part of our Rio Grande Food Project community. he walked through the food pantry doors about, I'd say in 2019, no, 2020 or 2021 for the very first time. And when he did that, it was the first time he had ever stepped foot in a food pantry. So for 32 years, Delphine had worked as a mechanic and he loved his work. He said that he would do it for free. He often talked about how much he loved his work. But the 51-year-old man lost several toes due to type 2 diabetes, and nerve damage from the disease made walking really difficult for him. He could stand for a total of maybe 15 minutes at a time before the pain became unbearable, and he'd have to lay down, and when he laid down, he'd get vertigo. So he was really going through a rough time. For a while, Delphine's boss at the mechanic shop that he worked at, would kind of allow him to reduce his hours and take jobs that were less hard on his body. But the next thing he knew, the shop closed entirely under the weight of the pandemic. So Delphine was jobless. He was worried about declining health. He described decades of fast food lunches and dinners to our staff team once we'd become pals with him. He said it was cheap, convenient. He said a burger was what everyone at the shop grabbed for lunch. And unemployment for the first time in 3 decades really terrified him. He didn't know how he was going to feed himself. He didn't know how he was going to take care of his aging parents, which was his sole responsibility. And so to do what he still could physically, he bought a wood lathe and he started making these really beautiful wooden bowls, wine stoppers, pens, and he'd sell his work where he could. But as his savings diminished, he finally looked up food pantries in his area, just as so many people have to do. So, I think that many of us who work in this field know just how difficult that can be. And we hear a lot of stories, if we haven't experienced it personally, about how much courage it takes to step through the doors of a food pantry for the very first time. And he allowed us to jot down something that he said a while back. He said he was embarrassed the first time. He said, quote, "I was scared as hell because I knew my whole world and mentality were reduced to a different level." And of course, we all probably cringe at this. This is the last thing we want, especially in the work that we do, that anybody feels so embarrassed, they become very difficult to seek help. And, we work with so many people who often say, I love helping people, but I think it's pretty rare that the person on the other end says, I just love being helped by people. We all want to live self-sufficiently. It's really difficult to ask for help, but he did it. And I always admire the grit of the families and the individuals that come to the food project for the first time. So after his initial visit, Delphine returned every week for some time. He became good friends with our staff team and our volunteers, and he really made the most of his visits, the most of the on-site resources that we provide every single food distribution. We have bill assistance, we have SNAP enrollment, we have warm referrals to job search specialists. And Delphine was especially moved by our emphasis on healthy foods. And this isn't easy to do in the food pantry world. I think many of us know that. It takes a real collective effort to source fresh local foods best we can, to ensure that it's not just the stream of the excess Oreos from Halloween, Walmart's Halloween stock that are on our food pantry shelves. Food is better than no food, but certainly healthy food and food that is appropriate for your diet and for your health conditions and for your cultural preferences is medicine. So Delphine was particularly moved by that. And what he expressed to us is that he began to manage his disease through nutrition for the very, very first time in his life. And it was thanks to a food pantry. I think that a lot of our, programming is shifting towards a serious focus on nutrition. And that's so key. Delphine's situation has improved. He, like I said, did take advantage of some partnerships that we have in terms of job placement. And so we see him a lot less, but when we do see him, he happily reminds us of his improved eating habits that began with the food project's help. So I tell that story solely because his situation really spans the many areas that the food project covers in terms of addressing this horribly difficult emergency problem of not enough food today, but also this long-term food insecurity that we see throughout New Mexican communities. The food project is located in a food desert. It spans Albuquerque's low-income and underserved South Valley and West Side neighborhoods. We're a food pantry addressing immediate food needs, where households are welcome and encouraged to pick up food with us every single week if needed. But we're also a community resources hub cultivating more long-term food security. And that's in part what we do in-house with our own staff team in terms of direct services and direct service bill assistance and SNAP enrollments, but also largely in partnership with some of the folks that are on this call and with experts in housing and experts in job placement. We are also an urban produce garden and a mini orchard operated by and with community year-round. We have a 34-year-long history of serving our community, and about a third of our food recipients are children and a fourth are seniors. So in preparation for today, I took a quick look at what the food project's numbers were mid-2023 through mid-2024. Just kind of a recent 12-month period. And the food project served 8,708 people, a combined 48,480 times. So that's over 8,000 people, who many of whom returned week after week to pick up food for themselves or for their whole household. So that's why we say over 8,000 people receiving food project groceries, a combined 48,480 times. This represented a 25% increase in need for free, nutritious food project groceries compared to the prior 12-month period. So we did see a 25% increase in need, and happily, we were able to increase the amount of food we were able to distribute by 45%. Because people were visiting more often and because the people that we serve were growing in numbers, that resulted in a 33% increase in the amount of food that each person gets every time their household picks up food. So we're certainly relieved to be able to do that. It's still not the amount of food that we were able to give away prior to the pandemic, because things have changed. And I know that many of us are facing these, these challenges related to food sourcing, to food expense. Grocery stores are becoming savvier in terms of their anti-waste policies. So rescue is a very different environment than it once was. But I'll just say a little bit about a few of the things that we've been able to do, again, largely in partnership with some incredible community organizations, to ensure that the amount of food that we have outpaces the need that we're seeing at the food project. Shout out to Roadrunner Food Bank. They've been working hard on a direct delivery model. So back in the day, we would work with them in order to get food out, in order to pick up food rescue food from local grocery stores on our own. So it would be our own driver, our own trucks, and we'd head out and pick up that food and bring it back to the food project. That program for us sort of fell to pieces during the pandemic for a number of reasons. But now Roadrunner has been doing a lot of rescue, and rather than taking the food back to their warehouse, they've brought it directly to the food pantry, so that, you know, we skip out on that day and a half or 2 days or 3 days where the food is in transport, especially because this food is safe and edible, but it is nearing its best by dates. And so Roadrunner delivering that food directly to the food project to distribute it immediately was really a game changer. Of course, there are challenges that come with that. There is a lot of waste associated with rescue. We do as much composting as we possibly can. But you also have to be pretty prepared with some major trash cans and trash pickups in order to ensure that you're only giving food away that you yourself would consume. We also increasingly buy in bulk. We've just realized that our model is different than it ever, used to be. We take 2 big trips to bulk retail stores almost every week. Costco knows us really, really well, to the extent that now they just put food aside for us and we come and pick it up rather than having to entirely shop for ourselves. That's good, but it's expensive, as you can imagine. And we're really interested in pursuing partnerships where maybe a few pantries order bulk foods together, pay for shipping costs together, and then split up the food. So if there's anybody on this call who's interested in that, let me know. We've strengthened our connections with local growers and food producers in a huge, huge way. It's become really important to us that the food that we bring into the food pantry is increasingly healthy, is increasingly fresh and local. We've done that in a number of different ways. We have partnerships with Food is Free, Seed to Need, Roots Farm, Agricultura Network, all of which donate a huge amount of food to us, and also have created low-cost purchasing models in partnership with our food pantry so that we can ensure that the communities we serve are receiving the freshest food. We're also a really, really lucky participant in the Regional Farm to Food Bank program. So the New Mexico Department of Agriculture, the New Mexico Association of Food Banks, the Food Depot, and the New Mexico Farmers Marketing Association initiated the Regional Farm to Food Bank program. This program allows local ranchers and farmers to receive fair market prices for their products while feeding those in need. So we're working with the Food Depot in order to have local growers deliver directly to us. The Food Depot has taken care of the purchasing side of these things. This is a time-limited grant, so pay attention to the funding models associated with those. Advocate for full funding into the future. But even if that funding disappears, we're developing direct relationships with, for example, Farm of Song, Silverleaf Farms, where we see their growers delivering to us on a regular basis. We know them by first name. We will continue purchasing relationships. We'll raise the funds in order to do that, even if these grants disappear. But that has been a game changer for us. Of course, we're always working with Roadrunner Food Bank to up our allotment of USDA TFAP foods, and we're so grateful to our food bank for helping to ensure that we have enough. And on top of all of that, we're just paying really close attention to not just measuring pounds. We always want to think about the quality of food distributed. We're improving our inventory systems to think about, is this food really preferable? Do we have control over the nutritional value of the food? How can we measure that up against a nutritious standard in order to feel certain and feel confident that we're doing justice for our communities, versus just the 650,000 pounds of food went out the door. We really want to be able to vouch for the quality of that food. And overall, these days, we've been able to, in the last year and a half, increase the food for which we can vouch in terms of nutritional value by 5%, which may not sound like a lot, but it does take a ton of work. It doesn't mean that the rest of the food is not healthy, but it means that it's coming to us through food drive donations. We just have less control, so it's subject to more variability. So that just gives you a small sense of the things that we're working on in order to keep up with the need and ensure nutritious food for all. Thank you so much for this time.
Thank you, Ari. Want to remind our participants that our time is limited. So, and I know Ari had a lot of information, so she did take a little longer than most of you, but we keep your presentations to about 7 minutes. I